So the question is, describe the typical intercostal space. I don't know why they use this term called typical, because there's nothing like typical intercostal space. Every intercostal space we have 11 in number on both sides. Okay, so if this is the sternum, okay, the rib part, okay, and the xiphoid part, we have 12 ribs on each side, right? So the space, if this is the first rib, the space between the two ribs, the first and second rib, is the first intercostal space. So in this way we have 11 on the left and 11 on the right. So this is intercostal space in general. There's nothing like typical, but there is this terminology called typical intercostal now. Okay, please be careful. We'll come back to what is the typical intercostal now. I think maybe the examiner might have got confused. Okay, a normal intercostal space or a typical intercostal space is same. There's nothing, there's no difference between all these 11 intercostal spaces. Each structure is similar. Okay, this is the first point I want to tell you. Maybe in future they might ask you a question on what is a typical intercostal nerve. Okay, so we'll come back to the intercostal space part first. Okay, so we'll be discussing it under two headings: what are its components, and very importantly, what is its clinical significance. Because understanding the anatomy of the intercostal space, it is vital while performing thoracic procedures, that is thoracocentesis or pleural tap. Whenever we do that, while passing needle, the needle should be in oblique direction and it should be above as far as possible. It should go just above, right? I'll come back to those details again, but again the clinical significance is it helps in performing thoracic procedures. Come back to the components part. It contains muscles, and very importantly it contains nerves and vessels, that is neurovascular bundle is there, and also it contains intercostal lymph nodes. So muscles point of view, we have three important muscles. Okay, three important muscles: external intercostal muscle, internal intercostal muscle, okay, intercostal, that is in between, external intercostal, internal intercostal, and we have innermost intercostal muscles. We also call this muscle as intercostalis intimi. Okay, intercostalis intimi. Different books use different terminology because there are a group of branches which are innermost intercostal muscles. Intercostalis intimi is a part of innermost intercostal muscle. We also have subcostalis. Okay, so there are different parts there. Well, let's not get into such details, but what you need to remember for this particular question is we have external intercostal, we have internal intercostal, and we have innermost intercostal muscle. Now let's look at its arrangement. So this is rib, the first rib I'm talking about, and I'm also drawing the second rib, and this is costal groove. What is this? This is costal groove, and within this costal groove we have three structures. In the from above downwards, it is vein, artery, nerve. Please remember, from above downwards it is in strict order. It will never change. Okay, it is in strict order, that is vein, artery, nerve. But where do they lie? They lie, I'll tell you. This is external intercostal muscle, this is internal intercostal muscle, and this is innermost intercostal muscle. Now where do they lie? They lie in between internal intercostal muscle and innermost intercostal muscle. The neurovascular bundle in strict order, that is intercostal vein, intercostal artery, intercostal nerve, that is VAN. They lie in between intercostal muscle, internal intercostal and innermost intercostal muscle. So this is how they are arranged. Okay, but what you also need to remember is there is a reverse order, that is now, artery, vein, okay, in the reverse order, now, artery and vein. So these are collaterals. These are collateral vessels. They are of least importance, but what is more important is the main neurovascular bundle, the primary neurovascular bundle, it is close to the first rib. For example, if I am doing pleural tap in the first intercostal space, while passing needle, I should be passing the needle directly above the upper margin, of the relevant rib. If I am doing it here, it should be above, directly above. If I am doing, there is no space here actually. In the first intercostal space, it should be done above the second rib, directly above in oblique direction. Okay, directly above in oblique direction will avoid collaterals and will also avoid neurovascular. As I go up, if I mistakenly do it like this, there's chances that I might injure this neurovascular bundle. So that's the reason whenever thoracocentesis is done, the instrument should have an oblique entry directly above the upper margin of the rib to avoid damaging the neurovascular bundles, and this is very, very important and important MCQ and important clinical significance point. Okay, now can we add few more things here? Definitely. Let's also try to look at what is a typical intercostal now. What is a typical intercostal now? So in general, this intercostal now is an anterior primary rami of T1 to T11 segments. So there are 11 intercostal nerves. They are the anterior primary rami of thoracic 1 to thoracic 11 spinal nerves. So anterior primary rami of thoracic 1 to thoracic 11. So these spinal nerves, T12, the 12th now, it is subcostal now. So the anterior primary rami of T12 is known as subcostal now because there is no costal space there. There is no 12th intercostal space. So rib 1, 2, 3. So if this is 12th rib, beneath the 12th rib, the anterior primary rami of the spinal nerve is actually the subcostal nerve. The remaining intercostal nerves are present in the 1 to 11 spaces. Now, the first two, T1 and T2, they not only supply the intercostal space, okay, they also supply upper limb. We know, right? They take part in a formation of the brachial plexus. T1 or sometimes T2, it takes part in the formation of the brachial plexus. And the lower 5 intercostal nerves, that is T7 to T11, they supply abdomen. Okay, so this not only intercostal space, they also supply abdomen, that is T7 to T11. So what are we left with? We have T3, we have T4, we have T5 and we have T-space. So only these 4 are typical intercostal nerves. They only supply thoracic wall. So if I ask you what is a typical intercostal nerve, it is 3T to T6 because T1 and T2 they also supply upper limb. T7 to T11 they also supply the abdominal part. T12 is not in the intercostal space, it is called as subcostal nerve because subcostal nerve is supplying the abdominal wall, not the chest wall, and also it supplies the skin of the buttock, the subcostal nerve. Okay, so this is one thing. That's the reason I'm telling you, if they ask what is a typical intercostal nerve, they're asking you T3 to T6. Now, in the further course of discussion, we'll be discussing only relevant points with regards to a typical intercostal nerve. Typical intercostal nerve. So what is a typical intercostal nerve? It is T3 to T6 and it is anterior primary rami of a spinal nerve. Primary rami, you have to remember this because we have a dorsal or posterior primary rami and we also have anterior primary rami. And where does it pass? It passes through in the intercostal groove, as I told you, in the order of vein, artery, nerve. So it passes in the intercostal groove below the neck of the rib, okay, and it enters the costal groove. So this is very important. Now I'll not be giving you the complete anatomy, okay, which may not be important for you, but I'll definitely give you the clinical anatomy aspects of it, right? So whenever there is an irritation of the typical intercostal nerve, what happens? It causes pain which it can refer to chest, or pain which can refer to abdomen. We call it as referred pain, root pain, or girdle pain. And also, if there is vertebral abscess, the pus from the vertebral column, it tracks along the thorax, along the course of the neurovascular bundle, and it can present at 3 points of exit. You have to remember this, 3 points of exit. So what are the 3 points of exit? It can be an exit of one dorsal rami on the posterior side, the dorsal ramus, or 2 cutaneous branches. So there are 3 points of exit for a vertebral abscess. This is the only clinical anatomy aspect you have to remember for this particular exam.